A 56-year-old man with severe claustrophobia requires a general anesthetic for an MRI scan of his entire spine. Regarding monitoring in the MRI scanner, which of the following would be the most appropriate combination of patient monitors in addition to a fiber optic pulse oximeter? A. 3 NIP, B. 4 ECG electrodes placed less than 20 cm apart, a NIP cuff C. 4 ECG electrodes placed less than 20 cm apart, a NIP. 4 ECG electrodes placed less than 20 cm apart, a NIP cuff C. 3. D2, total intravenous anesthesia, TIVA, is a commonly used anesthetic technique. A number of pharmacokinetic models exist which may be used to control drug delivery. Which of the following is the most accurate statement? A. The Marsh model for propofol would result in the delivery of a lower total propofol dose than the Schneider. The Marsh. Which of the following is the most accurate statement? The Marsh model for propofol. Then, B. The Marsh model. C. Using the Marsh model in pediatric patients is more likely to result in awareness than in adults. D. Total intravenous anesthesia, TIVA, is a commonly used anesthetic technique. A number of pharmacokinetic models exist which may be used to control drug delivery. Which of the following is the most accurate statement? Using the Marsh model in pediatric patients is more likely to result in awareness than in adults. D. D3, a 54-year-old man presents for a sigmoid colectomy for a colonic cancer. He is taking warfarin for a deep venous thrombosis that occurred 3 months previously. His warfarin will be stopped 5 days preoperatively and his inner checked on the evening before surgery. While the warfarin is stopped, the following should be commenced. A. D. Aspirin 70. E. Enoxaparin 0.5 mg kilograms 12 hourly. D4, a 30-year-old male is undergoing general anesthesia for appendicectomy. He has had a previous anaphylactic reaction to suxamethonium. You have performed a rapid sequence induction with rocuronium 1.2 mg kilograms. You are unable to intubate or ventilate. A laryngeal mask airway is in situ, but you remain unable to ventilate the patient. He is cyanist and bradycardic. What do you do next? E. Oxygenate via needle cricothyroidotomy. E. Oxygenate via needle cricothyroidotomy. Give 100%. D. Oxygenate via needle cricothyroidotomy. E. D5, healthcare-associated infections (CAI) are a significant burden to health services. The anesthetist plays a pivotal role in the prevention of transmission of such infections. One area of responsibility is to ensure that all anesthetic equipment is effectively decontaminated. Regarding the decontamination of anesthetic equipment, which of the following is correct? A. Laryngoscope handles should be sterilized after every patient, or disposable handles used. D. A 28-year-old female presents to the emergency department following a drug overdose. She is known to mental health services. Shortly after arrival, she develops vomiting, abdominal pain and lethargy. She later complains of severe blurred vision and is noted to have a severe muscle twitching. An hour later she has a grand mal seizure. The most likely drug is A. E. Lithium D7. Lithium D7, combined spinal epidural (CSE) anesthesia aims to provide rapid relief and a long duration of action. There are a number of techniques and a wide variety of situations in which this technique may be useful. Which of the following is most accurate? A. The paramedian. B. The Royal College of Anesthetists NAP3 audit shows that around 6% of neuraxial blocks are CSE. A 40-year-old female presents for a transsphenoidal resection of a pituitary tumor. Which of the following does not indicate an excess of growth hormone secretion? A. Retrognath. Obstructive sleep apnea. Her history. A 45-year-old woman attends the chronic pain clinic. She has had spontaneous widespread pain for 4 months. Her history and examination reveal a widespread pain index (WP) value of 9. She is suffering from altered sleep and fatigue. She is diagnosed with fibromyalgia based upon the American College of Rheumatologists (ACR) criteria. Which of the following is the most appropriate first-line treatment? A. Amitriptyline 10 mg at night. B. He remains comatose. A 53-year-old male was admitted to the intensive care unit 4 days previously with severe traumatic brain injury after a road traffic collision. He remains comatose despite cessation of sedation. Which of the following would be the most appropriate method for exclusion of significant cervical spine injury in this patient? A. D. A combination of plain film cervical radiography and helical computed tomography. A combination of plain film cervical radiography and helical computed tomography. A combination of plain film cervical radiography and helical computed tomography. A combination of plain film cervical radiography and helical computed tomography. Collision. You attend a trauma call where a 34-year-old male has been involved in a road traffic collision. He was intubated on scene due to a GCS of 6 and has a single 20G cannula in the left hand. The primary survey reveals markedly reduced breath sounds on the right side of the chest, pulse of 110 bpm and a blood pressure of 70/30 mmHg. He has bruising over the right flank. Which of the following is the next most appropriate step in his management? D. Establish large bore access and commence volume replacement. D. The anesthetist decides an 8 kg 11-month-old child is undergoing a circumcision. The anesthetist decides to perform a caul anesthetic. What volume of 0.25% bupivacaine is required to achieve a lumbosacral blockade in this child? A. 2 ml. B. 4 ml. C. E. D13. A GP has referred a 56-year-old lady who is 6 months post-fracture of the ankle and complains of ongoing ankle and foot pain that is not responsive to simple analgesics. Repeat ankle X-ray shows no significant abnormality. In the management of complex regional pain syndrome, CRPS, A. Most cases E. Vasomotor instability is a feature of CRPS types 1 and 2D. Vasomotor instability is a feature of CRPS types 1 and 2D14. Community-acquired pneumonias are commonly seen and may be severe, requiring anesthetic or ICU input. Knowledge of the causative agents and first-line treatments can improve outcomes. Knowledge of the causative vasomotor instability. D14. Community-acquired pneumonias are commonly seen and may be severe, requiring anesthetic or ICU input. Knowledge of the causative agents and first-line treatments can improve outcomes. Concerning community-acquired pneumonias, which statement is most accurate? B. C. Staphylococci are generally coagulase negative. D. Staphylococci are generally coagulase negative. D. Staphylococci are generally coagulase negative. D. Staphylococci are generally coagulase. Legionella are gram-positive. C. Staphylococci are generally coagulase. Legionella are gram-positive organisms. C. Staphylococci are generally coagulase negative. D. Despite repair 5 days ago, you are asked to review an 82-year-old man on ICU following an emergency aortic aneurysm repair 5 days ago. Despite his observations being stable throughout the day, he has become increasingly confused and appears to be having visual hallucinations. He has pulled out his nasogastric tube and arterial line and is trying to get out of bed, despite reassurance. What would be the best initial treatment? A. 2.5 mg intravenous haloperidol. B. You are asked to review an 82-year-old man on ICU following an emergency aortic aneurysm repair 5 days ago. Despite his observations being stable throughout the day, he has become increasingly confused and appears to be having visual hallucinations. He has pulled out his nasogastric tube and arterial line and is trying to get out of bed, despite reassurance. What would be the best initial treatment? A. 2.5 mg intravenous haloperidol. B. He has pulled out caul block. E. Spinal anesthesia with sedation. D17. Have been asked to anesthetize an ex-premature baby, born at 32 weeks gestation, for elective bilateral inguinal hernia repair. His corrected gestational age is 60 weeks and he weighs 3.5 kilograms. He was discharged home 24 weeks ago without ancillary oxygen and has been well in himself. What would be your preferred anesthetic technique? Caul block. B. Parachi. C. General anesthesia. D. General anesthesia with caul block. E. 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 General anesthesia with caudal block E. She is using and seeking increasing doses of oral morphine. She is using dislocation. A 20-year-old female with Ehlers-Danlos syndrome has long-term pain due to recurrent hip dislocations. She is using and seeking increasing doses of oral morphine solution to manage this. Despite this, her pain is poorly controlled and it is later discovered that she has not been able to relocate her hip for some time. What term best describes her behavior? A. B. Pseudo-addiction. C. Recipients of solid organ transplants may require other surgery. The priorities in preoperative assessment are A. E. Assessment of the function of the graft and detecting the complications associated with immunosuppressive therapy. D. Assessment of the function of the graft and detecting the complications associated with immunosuppressive therapy. Assessment of the function of the graft and detecting the complications associated with immunosuppressive therapy. D19. You have been asked to provide an epidural for a laboring mother. Your patient is a lawyer specializing in medical negligence. She wishes to know in detail about the risks of an epidural. Which of the following statements is incorrect? D. About E. The risk of needing an instrumental delivery is about 1 in 15. D20. A 10-year-old boy has fallen out of a tree and broken his arm. He is listed for open reduction and internal fixation on your trauma list. He is third on your list and the first 2 cases are likely to take 2 hours. He is complaining of pain in his arm, which he scores as 6 out of 10 on a visual analog scale and, other than receiving a 15 mg/kg dose of oral paracetamol on admission 1 hour ago, he has not received any other analgesia. What would be the most appropriate pharmacological management of his pain? D. Oral ibuprofen 5 mg/kg and codeine 1 mg. Oral ibuprofen 5 mg/kg and codeine 1 mg/kg. E. Oral ibuprofen 5 mg/kg and codeine 1 mg/kg. E. Oral ibuprofen 5 mg/kg and codeine 1 mg/kg. E. Are assessing a 39-year-old male in your chronic pain management clinic. He gives you a 6-month history of pain in his lower back. There is no history of trauma and he is otherwise well. Your examination is unremarkable. He takes regular paracetamol and ibuprofen, which slightly ease the pain. After discussing analgesic options, what would be the next step in your management of this patient? A. Offer a course of physical therapy. B. Clinical tests may be used to prove or disprove the occurrence of a disease, or to guide its management. These tests should accurately spot all patients who have the disease and also all those who are free from it. Which of the following statements regarding clinical tests is true? The negative predictive value (NPV) of a test determines the probability of actually correctly diagnosing people without disease if they test negative. E. The likelihood. 36-year-old patient presents in labor to your district general hospital. She has known rheumatic aortic stenosis with a mean valvular gradient of 55 mmHg. On examination by the midwife, she is found to have cervical dilatation of 6 cm. She is now asking for pain relief. You have cited an arterial line for close blood pressure monitoring and transferred her to the obstetric do room. Which of the following best describes an appropriate plan for her intrapartum management? A. Epidural for analgesia, and consideration of instrumental delivery early during the 2nd stage. D. Year-old girl presents to the emergency department following a suspected accidental drug overdose whilst playing in a garage. She is confused with slurred speech, miriasis and an ataxic gait. Later, she complains of nausea and is tachypnoic. A venous blood gas shows a severe metabolic acidosis and a BM of 7 mol/L. After 1 hour she has a generalized tonic-clonic seizure. What is the most likely drug that has been ingested? A. Ethylene glycol. B. A patient undergoes deep hypothermic circulatory arrest (TECA) during aortic arch repair. All the following are consequences except A. Left shift in the oxygen dissociation curve. B. Decreased cerebral metabolic rate by a factor of 2.6 for every 10-degree drop in temperature. C. Extracellular alkalosis. D. Altered rheology. E. Cerebral blood flow (CBF) autoregulation maintained with pH stat blood gas management. D26. A 78-year-old female is undergoing an emergency uncemented hemiarthroplasty under general anesthesia with associated lumbar plexus block. Following the insertion of the prosthesis into the femoral shaft, the surgeon relocates the prosthesis into the joint. Within 2 minutes the end-tidal CO2 falls from 4.6 Pa to 1.2 Pa, the pulse rate remains between 70 and 80 bpm and the blood pressure recorded is 50 mmHg systolic. What is the most likely cause? A. Massive fat embolism. E. Or due to anesthetize a 32-year-old male who is normally anuric with end-stage renal disease for his renal transplant. He has no other cardiorespiratory comorbidities and was last dialyzed 24 hours previously. As part of your potassium check at least within 6 hours of induction for his renal transplant. Or due to anesthetize a 32-year-old male who is normally anuric with end-stage renal disease for his renal transplant. He has no other cardiorespiratory comorbidities and was last dialyzed 24 hours previously. As part of your preoperative assessment you would most importantly confirm he has had a potassium check at least within 6 hours of induction. D28. Pharmacokinetics of anesthetic drugs in the morbidly obese patient changes significantly. Which of the following statements with regard to anesthetic drug dosing in the morbidly obese is true? Propofol used as infusion for total intravenous anesthesia, TIVA, should be based upon total body weight. D29. Rocuronium dose depends on total body weight. E. Propofol used as infusion for total intravenous anesthesia, TIVA, should be based upon total body weight. D29. You assess a 65-year-old gentleman scheduled for an elective abdominal aortic aneurysm repair the following day. You notice he is not currently taking beta blockers. Regarding the initiation of therapy, which of the following is appropriate? A. 50 mg. D. Postpone and give 2.5 mg bisoprolol initially, for at least a week prior to surgery, dose titrated to heart rate. E. Pheochromocytoma. You are asked to anesthetize a 30-year-old male for resection of an abdominal pheochromocytoma. A. Your preoperative assessment should focus on A. C. Assessment of the sympathetic blockade by alpha and beta antagonists, with an adequately controlled heart rate and blood pressure. E1. A 55-year-old male with chronic obstructive pulmonary disease is undergoing laser surgery. A flash of light is noticed, and the airway is thought to be on fire. The reading on the pulse oximeter is 90%. Your first action is to E. Discontinue ventilation and disconnect oxygen. E. Flood the air. Discontinue ventilation and disconnect oxygen. A 49-year-old male is on coronary care. He has suffered an ST elevation myocardial infarction. Primary percutaneous coronary intervention was unsuccessful for anatomical reasons, and he therefore underwent thrombolysis. He continues to have pain at rest, but without further ECG changes. On examination he is pale, clammy and peripherally cool. Blood pressure is 80/30 mmHg. The surgeons wish to have him transferred for stabilization and subsequent coronary artery bypass grafting. He should now be considered for A. Insertion of intra-aortic balloon pump. D. A 44-year-old lady is scheduled for pituitary tumor resection under general anesthesia. Over the past few years she has noticed her hands have got larger and her hats no longer fit. She has been diagnosed with acromegaly. Which of the following concurrent disorders is the patient most likely to exhibit? Hozfa or Cambridge University. B. Hypogonadism. C. Status prior to surgery. Cardiopulmonary exercise testing is a reliable and objective test for assessing functional status prior to surgery. There are certain medical conditions, however, which are absolute contraindications to undertaking the test. Which of the following lists includes conditions which are all absolute contraindications? A. Resting saturations less than 85%, unstable angina, thyrotoxicosis. Cardiopulmonary exercise testing is a reliable and objective test for assessing functional status prior to surgery. There are certain medical conditions, however, which are absolute contraindications to undertaking the test. Which of the following lists includes conditions which are all absolute contraindications? A. Resting saturations less than 85%, unstable angina, thyrotoxicosis, syncope. B. Pulmonary. E5, a 65-year-old male presents for emergency reduction of an incarcerated inguinal hernia. He has a history of resistant depression and is treated with phenelzine, a monoamine oxidase inhibitor. He receives 75 mg intravenous diclofenac and local anesthetic infiltration to the wound intraoperatively. In recovery he complains of pain of moderate severity. Which of the following would be the most appropriate analgesic option? Morphine 0.1 mg kilograms I. Patient suddenly. Morphine 0. E6. You are anesthetizing a patient for an appendiceal carcinoid tumor resection when the patient suddenly becomes profoundly flushed and hypotensive. What would be the most appropriate therapy to stabilize the patient's physiology? Adrenaline. Octreotide E. He tells a laparoscopic assisted hemicolectomy. A 74-year-old male with long-standing Parkinson's disease requires a general anesthetic for a laparoscopic assisted hemicolectomy. He tells you that he has had a general anesthetic 2 years ago and was unable to move afterwards. He was unable to tell you what drugs he was given and you do not yet have access to his old notes. Which of the following drugs may induce muscle rigidity in treated Parkinson's disease? B. Pethidine. A. Beta blockers may be used in the management of high-risk patients in the perioperative period to reduce cardiac risk. What is the main rationale behind this therapy? A. To decrease myocardial oxygen consumption by reducing the heart rate. B. E9. There are many ways to assess severity of aortic stenosis. B. Mean grade. C. Aortic valve area calculated by continuity equation during TT and indexed to body surface area. D. You are called to assist with a 17-year-old patient with Down syndrome having an appendicectomy. He is known to have a ventricular septal defect with Eisenmenger's syndrome and his saturations have dropped to 70% despite VO2 of 100%. The most appropriate intervention is to A. D. Give vasoconstrictors. E. He is acutely confused. Prolonged. You are asked to review a 55-year-old man in recovery following an uneventful, but prolonged, laparoscopic prostatectomy. He is acutely confused and has stridor. His past medical history includes hypertension, stable angina and a hiatus hernia. He had an uneventful general anesthetic with transversus abdominis plain blocks and 10 mg of morphine intravenously. What is the most likely cause for the confusion and stridor? A. CO2 embolism. E. Cerebral and laryngeal edema. E12. You are anesthetizing a 4-year-old child for unilateral squint correction. 20 minutes into the procedure, the child is breathing spontaneously on sevoflurane at a rate of 24 breaths per minute. Her heart rate drops to 40 bpm. You inform the surgeon and ask her to stop operating. The next appropriate action is A. Administer atropine. Allow. C. Administer adrenaline. D. Administer atropine 20 mg kilograms, then allow surgery to continue. E. Paralyze and ventilate the patient, then allow the surgeons to continue once the end-tidal carbon dioxide is within normal limits. E13. You are asked to anesthetize a patient with known aortic stenosis for an orthopedic procedure. Midway through the procedure the ECG changes from sinus rhythm to an irregular narrow complex tachycardia. The blood pressure drops. The most important action would be to A. Immediate cardioversion. E. Pregnancy causes a hypercoagulable state. Which of the following statements is most accurate? Fibrinolysis is reduced in pregnancy due to a decrease in T. Pennsylvania activity. D. E15. Regarding transdermal fentanyl preparations, which of the following statements is incorrect? A. C. D. Transdermal fentanyl can be used for acute pain control. E. Clarithromycin reduces the effectiveness of the fentanyl patch.